tonight we are here with Dr. Steffe to talk about vaginal health. How are you, Dr. Steffe?
I'm great. How are you?
I'm good. Thank you so much. For everyone that's joining us, actually, if you can let us know in the chat, um, where did you learn about vaginal health? I'm really curious to know, could be at home from a parent, could be family member, could have been at school, or even YouTube. And my personal experience, it's been a combination of all three.
Mhm.
I don't know for you, Dr. Steffi, but yeah, it's a combination of all three.
You know what? As I was creating this presentation, I was thinking, I'm like, I don't know that I ever actually learned about this stuff until almost had to, whether it be going to the doctor or even when I was in medical school. I'm like, oh, okay, like this is the stuff
Mm.
that we should have been taught.
Yeah, yeah. And that's why I'm so excited for tonight because I know there's a few things that I still don't know.
Hmm.
So I'm really interested for us to dive in. Before we start, I just want to share with everyone that this conversation is being recorded. So if you do feel safe enough to share, or if you have questions for Dr. Steffi, you definitely can answer or put those in the chat. And then she'll be able to answer those. We can either do it throughout the conversation or maybe done at the end. We'll see how it goes. But definitely, if you have questions, like this is the time. So Dr. Steffi is a naturopath doctor, and she's a great friend of us here at Inner Village and has a ton of knowledge to share. And so, of course, with this sensitive subject, we do ask as well that privacy is remained, right? So anything that we kind of speak about, definitely want to kind of keep it here or on the recording for Inner Village community. And of course, this is a space where we want everyone to be respected. So, just allow everyone to share their questions or their thoughts, and that can be that. So, Dr. Steffi, I will let you take it away. Thank you so much once again for joining
All
us.
right, so let's dive in. So, we're going to be unlocking the truth all about vaginal health. So, today we're going to talk about a couple of things. One of them being the anatomy. Hold on, I'm trying to get my next slide. There we go. So we're going to talk about the anatomy. So like what actually is a part of vaginal health, what that means, what else is around the areas and in the reproductive system, what's considered healthy, what are some common infections. Sometimes we learn about vaginal health after having a certain infection, and then what we can do to support it. And then at the end, we're going to have a question and answer period where we can really chat and share our experiences as well. So, as Kim mentioned, I am a naturopathic doctor. I am based here in Toronto. And I have such a deep passion for helping women just learn more about their health and teaching them that they have the inner ability to heal. So their body has that ability to heal itself. And I love teaching women how to do that. And so I'm so excited to be diving into such a popular but taboo topic today. So let's get started with anatomy. So, and now the next slides, they are going to be a little more graphic. So just want to let you know, but it is something that it's normal and it's part of our anatomy as women. So the thing I find a lot is sometimes we interchange the naming. So we could be referring to the outer parts of our reproductive system as our vagina when that's not actually true. So the outside is called our vulva. So our vulva, and this is the part where like if you're just like looking at yourself, you can see it. And there's different almost we can refer to them as like lips. So and they're called the labia. So I'm going to use my pointer. And this is the stuff that sometimes we're never taught. So there's the labial majora, which is like the bigger and the fatter part. And then on the inside is the minora. And those are just the technical terms, but that's what's considered our vulva. And that's on the outside. So sometimes, when we're, like I was saying, we're referring to our vagina when we actually mean our vulva. Vulvas, yes, they all look different. So this is also an area where sometimes if we see pictures or sometimes we see other women's, we might be wondering like, oh, is mine normal? Is it not? They're all different. This is when we're the uniqueness of being human when it comes in, where they can all look different. So I imagine for most women, it's a normal thing. Um, if you ever feel that something is off, this is when you can go to your doctor and they can let you know if there is something happening with your vulva. Now, on the inside, so that's actually what our vagina is. It's the internal part of our reproductive system. So the vulva is on the outside, and then the vagina, I almost like describing it, it's almost like an inner canal. So in that inner canal, that's where if we do have a baby, that's where things will pass through. When we have our period, that's where it passes through. If we're ever using like a menstrual cup or a tampon, it's going into the vagina. So that is on the inside. And that's kind of like what we're going to be focusing more on today, more on the internal vaginal health. So what's actually considered a healthy vagina, or what is vaginal health? And this is where a lot of the taboo comes in, where you can hear about smells and discharges and different things that we can experience with our vaginas. And this is where I'm really hoping to bring some education if you don't know this already. So, a big topic around vaginal health is, what is it actually supposed to smell like? So, naturally, our vaginas actually should be acidic. And it's acidic for a reason, because that's actually what's protecting us against any other type of infections or bacteria, different viruses. So, we want our vaginas to be acidic. And with it being naturally acidic, it can have more of an acidic smell. So, almost imagine if you've ever smelt any type of like vinegar and thing, if there's a little bit of that acidity or like tartness, sometimes vaginas can smell like that. Outside of that, it is still a body part of ours that has certain sweat glands in it. So, similar to our underarms, when we go through puberty, that's when we start developing body odor. It's a similar thing in our groin and in our pelvic region. Um, when we sweat, we can have body odor. So sometimes that can happen in that area of our body. Not to be alarmed, it is a natural thing, but just wanting to let you know that there can be BO. And also, because our vagina is an internal part of our bodies, there's access to, things that we ate and things that have been broken down in our body. So depending on what we ate, often if, let's say, we had things that are garlicky or onions, sometimes that can come out in how our vaginas smell. So depending on what we ate, sometimes that's what it can smell like. Now, in terms of discharge, now there is a healthy amount of discharge, and sometimes, honestly, I don't not even sure that I like using that term, because discharge often usually signifies that something is off or imbalanced. Where when it comes to our vaginas, we have more of what's called cervical mucus. So there's another part that's a little further up in the vagina, where it's our cervix. And the cervix is kind of the thing that separates the vagina from the uterus. It's like this stopping point. And in that cervix, we release certain mucus depending on where we're at in our cycle. Now, I'm going to dive a little more into cervical mucus in a few moments, but I just wanted to share that often, sometimes we see some mucus in our underwear, or if we are doing any type of internal examination, like a self check, we can see some of the mucus. And one last thing in terms of our vaginas, like I was saying before, that they should be acidic. And what helps it be acidic is actually we have bacteria in our vagina. Now, bacteria isn't always a bad thing. Now, I'm sure you might have heard of things like probiotics and whatnot. Now, it's a similar concept where there actually is good bacteria. And this bacteria is what creates that acid and what helps protect us. And this is where, when we say our vaginas are self cleaning, meaning often our body knows what it should be doing and it can naturally clean itself. And often we don't actually have to be doing anything to further help that because our body is doing what it should. Now, with the cervical mucus, depending on where we are in our cycle, it influences what it looks like. So I kind of broke it down into some common phases that we go through. So after our period is finished, often, for a week or so, we might not have any type of mucus that's coming. It can be dry, and if there is mucus, it is more like sticky. So it's something that is a more of a thicker consistency, and sometimes it could be white in color. And then from there, it's going to transition into something that's a little more clear and slippery. Because what's happening is the body is preparing for ovulation. And ovulation, from a more biological standpoint, is the body's way of preparing to become pregnant. So it's wanting your body to allow, if you were to be having intercourse, it wants the sperm to be able to reach your egg. And the way that it can help that is through slippery mucus and almost like lubrication. So when you are ovulating, that's kind of like when you're at the peak. And that's when it often becomes very slippery and it could be very clear. I often describe it as in terms of like if let's say you crack open an egg and you look at the clear part, like egg whites, it's like that clear, stretchy type of consistency. Then once your body is already ovulated, after that, it's going to go back into more of a creamy, sticky consistency, and it could also be white in color. Now, sometimes as women, especially as women of color, sometimes our skin from our vulva, sometimes dead skin could just kind of rub off on our underwear and can mix with the cervical mucus. So there can sometimes be a little bit of a yellowness, but it shouldn't be anything that is very significant. I would say if like it's a pale yellow, then that can be normal depending on your skin tone. So let me know if you guys have any ladies have any questions about cervical mucus. Is this something that you've noticed in your body, especially on a month to month? And did you know if this was normal or not? Let me know in the chat. Now we understand what's happening on the normal side of things. This is when in infections is another great topic for us to chat about because, like I was saying, this is often when we really start focusing more on vaginal health is when something kind of goes off in the system. So, what are some common infections that we can have? One of the most common ones is called a yeast infection. So similarly, when I was saying how there could be good bacteria in our vaginas, there's also good what I call good fungus. So when you get a yeast infection, yeast is actually something that should be there in the vagina, but what happens is that it overgrows. And when it overgrows, that's when it's considered an infection, and that's when you start getting symptoms. So, some common signs of a yeast infection is when you're having very, very thick white discharge, and sometimes it can have like little chunks in it. So, this is a little different from the previous slide and what we were chatting about in terms of cervical mucus, where that can get a little thick, but this is more of like a substantial thickness, and you will often notice the difference. With a yeast infection, you can also get some itching. So you can get itching whether it be in the vagina or in certain areas of your vulva. That can be indicative of a yeast infection. And then sometimes there could be redness. So many times if a woman has a yeast infection, her the area can feel sore and it can be red if she looks at it. So that's a yeast infection. Now, the next common vaginal infection is something called bacterial vaginosis. Um, Let me see. Oh, it's not changing. Okay. Can you guys see it now?
Yeah, it looks
Okay.
now we're seeing the common infections. Thank you.
Okay. Sorry, guys. This whole time I was thinking that it was sliding over. I don't know what's happening here. Um, so with bacterial vaginosis, one of the more prominent features of it is a change in smell. So there's often what we call like a fishy odor. That's often the telltale sign of bacterial vaginosis. You can have discharge and the short form for it's called BV. So I'm gonna like interchange it. So in terms of BV, you can often have discharge that's a little more gray. So sometimes it can look like white, but when you really look at it, there's a tinge to it and it could be a little more gray. And with bacterial vaginosis, you can also have itching. Now, sometimes there can be redness, but it's not as common. So if you kind of wanted to know like the major differences between the two, I would say yeast infections is more of discharge, itching. There typically is no smell. Bacterial vaginosis is usually the change in smell and a gray discharge. Now, the best thing to do in order to figure out if you have either or is to be going to your either your medical doctor or your nurse practitioner and getting what we call a vaginal swab, and then they could send it to the lab, and then this is how they can confirm if you have one or the other. Now, sometimes you can have both, but it's always good. I would say it's always better to get it checked and tested versus, just going to your local drugstore and taking an over-the-counter treatment without knowing what it actually is, because sometimes that can make things worse. Are you guys seeing the next slide? It should be for STIs now.
Yep.
Okay, awesome. So that's more common vaginal infections. Now, also coupled in this group are sexually transmitted infections, because this is where it will show up for women. Now, this is where also I find many women know a little more about, because this often are the things that we might have learned in, let's say, high school or whatnot. But let's kind of just go over some common STIs, because it's always great to either have a refresher or learn more about them. A common STI would be chlamydia. Now, the thing with STIs, the reason why it's so important to get tested and almost frequently, because there often actually is no symptoms. Many times patients can, not really have symptoms they don't know, and, they do have an infection. But if there are symptoms, this is when, if you do have discharge, it can be a little more, there'll be more of a contrast where you're like, okay, I know something is off and is not right, because often you can get a more yellow or green discharge. And sometimes what can happen is outside of your period, you can have some bleeding. And I didn't mention it on the slide, but then sometimes you can also have lower pelvic pain. The thing with chlamydia and the next one would be gonorrhea is they're very similar in their symptoms. So this is another thing where it's great to be tested. Now, there is one that isn't really talked about as much, but it's called trichomonas. And that one is also an STI and it has similar symptoms. So if you notice, it's just like they all look the same. So it's always best to get tested to figure out which one you have if you do. And the reason for that is because there's often different types of antibiotics or whatnot, depending on which infection you may have. So we always want to get tested. And this is a time where antibiotics would be necessary. And it's an easy thing where you would go and you would either have a week or so treatment. Sometimes for some of them, it's even like a 1 or 2 day thing. But this is a time where you would want to have antibiotics just to get it cleared out of your system. Now, we've talked about what things should be looking on a healthy side of things, what can happen with certain infections. What can happen if we have more of like yeast infection or bacterial vaginosis? What could we do naturally? Like how could we naturally support that when it's something that's not as extreme as an STI? So in terms of supporting our vulva, this is an area where we actually can use a gentle wash. So as I was mentioning before, sometimes we can have body odor because we could be sweating in that particular area. This is where we can use soap. I would recommend for it to be non-scented. Sometimes there are certain soaps that also have like glitter and things. I wouldn't recommend that because that often it can just disrupt the area. And we want to keep it to the outside, meaning you can wash yourself on the outside, but we don't want to be going into the vagina. And that term is called douching. Basically, inserting something in the vagina in attempts to clean it, when often that does more harm. Where this is where I would recommend not to do any type of douching and keep any type of washing to keep it on the outside of your body. Now, what can we do on the inside? So let's say you do have a yeast infection or bacterial vaginosis, or maybe you just know that, maybe it hasn't got to a yeast infection or to BV yet, and you just know something is off. What can we do to help? So this is where the body is just so interconnected. So our vaginal health is actually very connected to our digestive health. So our gut health. In our gut, we have the good and the bad bacteria in there. And depending on what's going on there, that can influence what's happening in our vagina. So if we have a little bit of an imbalance in our digestive system, that's often what can open up the grounds for a yeast infection or for BV to get started. So this is when we want to, even though we're like, okay, we're talking about vaginal health, we have to talk about gut health. So the way that there's several ways we can support our gut. One of them being through taking probiotics. Probiotics can be great because it can help balance things. It can help balance things out, um, so that can you see the vaginal support now? So weird. I don't know why it's not going because it's changing on my end. Um, with probiotics, it can help balance things out. Now, with probiotics, there's so many different ones on the market. There's certain strains that I advise my patients to take because some of them are based on research where there's certain probiotics you can take by mouth that can positively influence your vaginal health. I put them down on the slides there. They're long words. They're called lactobacillus. But there's two specific strains that I often like having, so I'm making sure that we look at that. But you can also get probiotics through fermented foods. So things like sauerkraut, kimchi, kombucha, pickles, anything that's fermented or pickled can have positive probiotics and good bacteria in there. So the more we eat that, the more we're supporting our gut health. That means we're going to also be helping our vaginal health as well. Now, we talked about what we can add in, but what can actually imbalance the system? So, like, what can imbalance our gut for the bacteria to be not where we would ideally want it to be? And this is where food choice comes in. So things like sugar and processed foods. So processed foods often could be like fast foods. Sometimes it could be packaged goods, things like crackers, bagels, often things that are what we call refined. So often white flours, usually things you find in bakeries, in certain restaurants. If we're eating a lot of those foods, this is what causes that imbalance in the bacteria in our gut. And this is what can make things worse. So we talked about, okay, what we can do in terms of supporting our gut, but what can we actually do to actually focus on the vaginal area if we do have BV or a yeast infection? So, similarly, where we might be taking a probiotic by mouth, we can also take a probiotic suppository, meaning we can insert one in the vagina to help balance things out. And similarly, we want to make sure it has these particular strains. And I've included the ones that I like using. So, if you are going to be using some, looking for those kinds can be helpful. But on top of that, we want to help, like I was saying, re-acidify the vagina. Because when we have a yeast infection or bacterial vaginosis, often what happens is the vagina goes from being acidic to a little more alkaline. So we want to get it back to that acidic point place. And the way we can do that, or there's a couple of ways. With some of my patients, I like using vitamin C. So vitamin C is actually acidic, and they do have products on the market that were made for vitamin C to be inserted vaginally for BV or for possibly a yeast infection. This is something you can chat about with your healthcare provider or also your pharmacist. The beauty with vitamin C, it is over the counter, at least here in Ontario, where you can get that if needed, so you wouldn't need a prescription. Another great thing is called boric acid. That's another thing that we can use as a suppository to insert in the vagina so that we can help acidify and rebalance things so that we can get um, the the bacteria in our vaginas to a place where it becomes acidic. Now, the thing with boric acid is that often in Ontario, often you would have to get it what we call compounded by a pharmacist. But from being on social media and seeing different brands, they're based in the States. And I've seen that you can be able to order them. So I don't know in terms of like Health Canada, like if you can order it and you can get it and you won't get a restriction, but it's something to talk to your healthcare provider about because boric acid can be a great thing that will balance the system. So another thing that we also want to chat about when we're talking about vaginal health is our menstrual products. Depending on whether if we are using ones to insert, and even if we aren't, we also want things to be of a good quality because it's such a sensitive area. So this is where I recommend if you are using pads or tampons that it be 100% organic cotton. And I say that because many conventional products on the market, they're cotton, but they aren't um, organic. And the reason why that can be an issue is because when let's say you're wearing a tampon that was bleached and it also has pesticides in it. Pesticides are meant to kill things. So sometimes they can be killing bacteria. And like you just learned, if you didn't know previously, that our vagina has healthy bacteria in there. So sometimes the residue from the pesticides in, let's say, a non-organic tampon, that could be disrupting the bacteria in vaginas. So this is an area where sometimes maybe you're getting frequent BV or frequent yeast infections. Sometimes it can be your tampon use that can be making it worse. It might not be the cause, but it could be something that's almost what I call like adding to the fire, which is not helping. Similar way in terms of wearing a pad, because it is a sensitive area, we want it to be organic cotton as well. And the beauty of menstrual cups, I found that they've become very, very popular now. So that is another great alternative where you can insert the cup. With that, you just want to make sure that you're continually washing it. Because I would say if you have like frequent yeast and bacterial vaginosis, sometimes it might be helpful just buying a newer cup, because even with you washing it, there might be some residual bacteria or yeast on there, and you might be almost like reinfecting yourself. Yes, and Tiana shared the honey pot. They also carry boric suppositories. Oh, that's great to know that they ship to Canada. There's another company as well. I think it's called Love Find or Love Kind. But that's great for the honey pot. Yeah, I actually don't know what the regulations are in Health Canada, like why we couldn't create one. That's probably something I should look into. Um, so yes. So that wraps things up. Let me know if you guys have any questions. And I apologize that for whatever reason my slides weren't showing. So I think there was the vaginal health slide. Hopefully you can see it. And let me know I wonder if I should share my slide deck as well, because you guys were saying you couldn't see some of my slides. So Kalisha's asking about period underwear. So the thing with period underwear, I think it could be very helpful for the environment in terms of, not creating waste. With that one, I'm not sure in the sense of supporting vaginal health. The jury's still out. Where we don't know enough information about it. I know at one time there was a little bit of a debate in terms of what like actual products and materials they were using, wondering if it had like plastics or if things were like off gassing from the material. Because it's so new, it's so hard for us to know. Has anyone used period underwear, like what your own personal feedback is? Is there a safe way to shave, wax, laser, pubic hair? I would say in terms of like hair removal, it would really depend on what works best for your body. Because I have had patients where sometimes, regardless of like sugaring or waxing, they would have their skin would be sensitive, or, they would get ingrowns. That one I would say you kind of have to like figure out. Usually, the thing with laser, it's not going to come back. With that, you would want to just be finding an esthetician that has worked with, if you have melanated skin, that they have worked with people with brown skin, because sometimes the laser, it can burn your skin. Yeah, in terms of period underwear, it's actually something that I personally haven't used as well. I think I'm still trying to gather my, information about it to see how it is. And also let me know if there's any other slides that you guys had wanted to let me share. Yeah, so the thing, yeah, I find with period underwear too, it could really just depend on the amount of your flow, and just your own comfort level, to like how you feel, because that's also an important thing too, where it really depends on how you feel in your body and your experience as well. So in terms of vaginal health, yeah, so I would recommend getting what's called a vaginal swab. So usually with a pap smear, you can ask them to also do a swab. So with a menstrual cup or a vaginal cup, if you have a heavier flow, they do have cups that hold a bigger, like different cup sizes. And often after we have children, sometimes it can change also the way that the vagina is. So they usually make a bigger menstrual cup for women that have had children. It's one of those things where you kind of just have to try it out and see how it goes. Um, and the thing with menstrual cups, if it is something you're curious, just giving it a try and maybe even trying different brands, um, and seeing which one could be working for your body. And were you guys familiar with the different types of infections? I know yeast infections could be a popular one. Um, but sometimes with patients. So, should individuals with frequent yeast or BV consult a physician for further testing? Yes. So, this is when I would say you would want to be working with a physician. And also, this is when, and I'm not, it's not a shameless plug, but also working with a naturopath at the same time. The reason I say that is because what I've found with many patients that have frequent infections is their doctor just keeps giving them antibiotics or like antifungals without kind of taking a step back to be like, okay, have we looked at their gut health? Maybe it's something also depending on their sexual practices. Are they peeing after intercourse? Are you wearing cotton underwear? Because those are things sometimes that can increase the prevalence of something like a yeast infection. Because often, if you're getting frequent infections, it's a sign that, yes, something's happening in the vagina, but there's probably other areas of your health that also need support. So with cranberry juice, that is more for what we call a UTI, so a urinary tract infection. That's more around if so that's like a different part of your body. So it's close. So your urinary tract is basically where you would urinate. So it's very close to the area. What cranberry can do is it can help just like flush the system out so that bacteria doesn't attach. But that would be different for vaginal health. So it would be they're two separate things. There's a similar area, but it'd be different. Or close area, I should say. And when Kim, when you're saying teas, is it for just like overall vaginal health? That actually made me think of is this Jamaican in you? That made me think of vaginal steaming. That is something that I didn't even think of at the time to put in to the presentation. So the thing with vaginal steaming, I would support it as long as it's nothing that's being inserted and it's just actually a steam. And as long as you're buying it from a reputable person where you would want to make sure the herbs are of a good quality. So if they are organic, that would be the best. Or if there's something called wild crafted. Because think about if, let's say, they're herbs that, had pesticides on them and then you're going to steam it, it's just going to kind of concentrate a lot of that. Because what the steam does, it really just promotes a lot of blood flow to the area. So it can be helpful just to bring blood flow. So raspberry leaf tea, that would be helpful for more of the uterus. So that could be a great tea. It actually tastes quite yummy, in my opinion. It's something that can help with potential period cramps. It's also really great, given you're under the guidance of a practitioner. Can also be great when you're pregnant, nearing your like you're in your third trimester, getting ready to go into labor. That could be a great thing that gets the uterus nice and ready. Yes, raspberry tea is lovely. It's a very gentle, and it's actually a nice tasting tea as well. Yes, holy basil. That would be really nice. Holy basil and raspberry. That would be a great blend.
I have a question for you, Dr. Steffe. How
Yes.
much does dairy affect vaginal health? Does it?
Yes. That is a great question. I would say it can. So, what can happen is if we're consuming a lot of dairy, it can actually increase the amount of like cervical mucus you produce, especially if it's like white and thick. Now, it wouldn't be a yeast infection, but it can just increase your body's production of cervical mucus. So, it's something that a lot of my patients notice. The more dairy they eat, they're like, "Oh, actually, I had a lot more mucus in my underwear than when I don't eat dairy." Both, actually. That's a great question, Kalisha. But dairy, processed foods, it's one of those things where it's anything that could potentially be creating inflammation in your system. So yeah, dairy, gluten, processed foods, sugar. Sugar is another really big one where it can create more of that discharge. It's almost a sign that your body's like, hey, something's not right. So I'm just going to produce more of this as a way to kind of show you to pay attention. Yeah, that one's a big one with discharge is sugar as well. Detox pearls. Um, if I'm familiar, that's just like herbs and they would be inserting it. If I'm familiar, I feel like it was a big thing at one time. If it is that,
Sorry,
like
I
the
didn't hear your question. What did you, can you repeat that? Sorry.
you're asking, I just want to make sure that I'm speaking correctly on it. But the detox pearls, I think it's like herbs and it's in like a ball and you would insert it in the vagina.
I'm honestly not sure if it is herbs. I'm not sure, but I do have a friend who uses it specifically to help her fibroids, from what I understand. But
Okay.
I'm not quite sure if it is herbs, but I do know they're like round, pearl-looking items that you would insert inside the vagina for a few hours, I think, throughout the day. And
Hmm.
then once it comes out, from what I was told, scar tissue would begin to come out of her vaginal canal.
Mm. So it's hard for me to like speak on it if I don't really know what's in the pearl, but usually anything that's being inserted in the vagina, like it, I'm not for it unless it's, done by like an actual practitioner, herbalist. With it helping fibroids, I don't want like I'm not sure that it would. Because what can actually be happening, it could just be promoting like blood flow or even just clearing out something called like your lymphatic system. So stuff could be coming out, but I don't know that that's if it would actually be scar tissue. Because depending on the herbs, that if it is herbs, that sometimes can also cause an imbalance in even a more of an imbalance in the vaginal bacteria. Hope that helped. It's something that I could look more into. Okay. Um, So Kalisha was saying more anti-inflammatory foods. Yeah, it definitely would. It would for sure help your vaginal health. It would help. It would help your whole system. These are great, great questions, ladies.
Do we have any more questions for Dr. Steffe? If we do, this will definitely be the time. You can turn the chat or turn your mic on. In the meantime, Dr. Steffe, can you talk to us a little bit about your services?
Mm-hmm.
I know before I was asking you about your naturopath services, and you are based in Ontario. So maybe speak to a little bit of some of the services that you offer.
Yes, yes. So I'm based in Ontario. So what that means is I can see you on a one-on-one basis for people that live in Ontario to really give you that individual guidance on what you can take and kind of just like what's happening in your body. Because often we come in for one thing, but there's other parts of our health that could be influencing it. So I help you make sense of that. So I would love to see you if you need any type of assistance. Um, my practice is in Toronto. And then I also, every now and then, I run different classes. So I think it was in May, I ran like a period master class. I'll probably do another one at the end of the summer, just as a way to learn more about periods, hormones, women's health, and those different type of topics.
Wonderful. I am also going to share Dr. Steffi's Instagram link. She always has a ton of information that's super helpful. Um, so I'll share that in the chat. And also, in addition to your online courses, I know you had like this hormone quiz, or you had
Mm-hmm.
this hormone method. Can you talk to us a little bit about that? I feel like some of our community members may want to take that quiz. I know I did, so that was
Yes.
interesting.
Yeah. So I have a hormone quiz. Really just helps you understand or see if you have any common hormonal imbalances. So whether it be an excess amount of estrogen or a low progesterone, the quiz can kind of help give you an idea what might be happening and also just to make sense of your system symptoms so you know what could be happening. And I also have a hormone program where it's a 12-week program that really walks you through the steps to take to get balanced hormones so you can have pain-free and PMS-free periods.
Thank you so much, Dr. Steffi, for taking the time to, share the information. I know there were a few myths that now have been put to rest about vaginal health. And everyone that is with us for tonight, thank you so much for joining us. If you do have any other questions, Dr. Steffi is also a member in Inner Village. So feel free to reach out if you have any questions about her services, you want to book her or take one of her upcoming classes, definitely reach out. Um, we are so appreciative of this conversation. It will also be up in our on-demand section very soon. So if there's anything that you didn't get a chance to write down, you'll have the recording to go back to as well. So once again, Dr. Steffi, thank you so much for being here with us.
Thank
Really
you.
appreciated
Yes, my
this
pleasure.
chat. Yeah, I love that everyone was able to kind of share, some of the things that they were having questions about. So super thankful for that. Now for Inner Village, we do have an upcoming event coming up. So you can definitely take a look there in Inner Village in the events section to keep up to date with what's coming up. So next Wednesday on July 28th at 7 p.m. Eastern Time, we have a meditation and journaling session that's going to be really wonderful with Denise, followed by Chapsal Yoga session on the 29th. And don't forget, our book club is starting up again on August 1st. So you can definitely obtain your book to join us on that. So we appreciate you. And as always, we want to let you know that you deserve to be well. Thank you for spending your evening with us, and we'll see you in Inner Village. Take care, everyone.